Hey guys, so I wanted to take some time to answer a question that we frequently get, or the administrators frequently get, as people are going through this pre-surgery process and kind of wondering about bariatric surgery and what could help them. And a common question, especially for females of reproductive age, is can weight loss surgery help with my PCOS and fertility issues? And, PCOS, or polycystic ovary syndrome, is one of the main causes of infertility issues for women. It's a little bit more controversial than what I initially thought of. I'm somewhat familiar with it just from being in this community for so long, but I did a little bit more research on PCOS to kind of talk to you guys about this today. And I was pretty surprised about the information and then more of the sort of controversial facts and thoughts about PCOS. So it is a, sort of hormonal condition. It's not a disease. There's no specific test that a doctor can give you that says, without a doubt, you have PCOS. But it's sort of characterized by excess levels of androgen hormones, which are typically the male hormones. Now, all, men and women have both testosterone and some estrogen. All women have some testosterone, but really what makes it different in PCOS is there's higher levels than normal. And that can affect, your fertility. It can affect how you menstruate, your ovulation cycles. It can, take longer for you to ovulate. You might have prolonged periods. So just a little bit of information there. It's also something that we commonly think of associated with obesity and females that are overweight. However, after looking into this a little bit more, it's actually just a normal representation of females in the population. It's not necessarily higher in those that have, weight-related issues or are trying to lose weight. But it is a factor with fertility, and since a lot of women that are overweight or obese do have a harder time getting pregnant, it does seem to kind of be a little bit more correlated there. So the issue with PCOS is there's potential effects on your lipids, so dyslipidemia. There can be excess insulin in the bloodstream, which can especially make cravings for sweets and breads and carbs much stronger and harder to control. A lot of times too, PCOS is associated with sort of heredity. So if you had a mother, grandmother, aunts, cousins that had it, there's potentially a higher chance that you do as well. And it's not necessarily associated with cysts on your ovaries. I always kind of thought that if you had cysts, you had PCOS, but that's not necessarily true. People have PCOS that don't have cysts on their ovaries, and vice versa. So, but there is some really, pretty convincing research out there. I'm going to post the link to an article from Sages, a study that was done, and actually they looked at a bunch of studies that were done and kind of compiled it to make a better conclusion. But there is some really, really positive data showing the effects of weight loss surgery and lowering the incidence of PCOS, the symptoms, and potentially helping with fertility. So real quick, I have got my computer here. You can't see it. I'm going to read just a few of the stats. And then again, like I said, I'll post the link so that you can read through it if you want more of the specific information. But in this Sages study, they included 13 separate studies and then made a conclusion from those. And in those 13 studies, they had over 2,100 female patients with a starting BMI of over 48, which decreased to 33.6 after surgery. So technically still obese, but a significant drop in overall weight and BMI. And so when they looked at the PCOS incidence, it went from 45.6% to 6.8% at 12 months post-op and 7.1% at the study endpoint. And then, let's see, 56.2% preoperatively reported having menstrual irregularity, meaning they weren't sure when their period was going to come, when they were going to ovulate. And this decreased to 7.7% at 12 months and then continued to decrease to 7.1% at the endpoint. And then one more real quick, the preoperative infertility rate was 15.6%. which again dropped to 1.6% overall. So it's pretty convincing. There's some really positive numbers for those of you that are interested in weight loss surgery to maybe try to get healthier, but also to potentially help with, any symptoms that you may have with PCOS, and more specifically even fertility. And everyone with PCOS is not trying to get pregnant, but it is nice to just know when you're going to menstruate, when you're going to ovulate, because that's something from a female perspective that can be a huge issue with your quality of life if you're just not sure. And so there is hormonal therapy that's out there as well. You can talk to your primary care physician about that. But having weight loss surgery and maybe combined with hormonal therapy, or maybe if you have weight loss surgery, you won't need hormonal therapy. There's some pretty positive and exciting things out there. So let me know if you have any questions. I'll do my best. I'm obviously not a physician, so I can't answer to this necessarily from that perspective, but I can just sort of share some information with you that I've found through just my own general research, and then maybe help to point you in the right direction if you do have more questions.